Ever thought of being trapped in the middle of Antarctica, with no way to call for help, and suddenly you feel a sharp pain in your stomach that just won't go away? That's exactly what happened in 1961 to Dr. Leonid Rogozov, the only doctor stationed there at the time. With no rescue possible, he had to do something unthinkable: perform surgery on himself to remove his own appendix. Because without doing surgery, the appendix could burst, and he could have died. His story shows just how dangerous appendicitis can be. But do you know doctors don't always perform surgery in appendicitis? Stay tuned till the end to learn why doctors sometimes skip surgery. So, what exactly is appendicitis, and why is this tiny organ such a troublemaker? The appendix is a small, finger-like pouch attached to the large intestine. For years, people thought it didn't do much of anything. But research suggests it might serve as a safe house for healthy gut bacteria and could play a small role in immune health. Even so, this little structure can cause big problems. Appendicitis usually starts when something blocks the opening of the appendix. Sometimes it's a hard piece of stool. Other times, it's swelling triggered by an infection. Once the appendix is blocked, bacteria inside multiply quickly, pressure builds up, and the walls of the organ become inflamed. The first sign is often pain near the belly button that shifts to the lower right side of the abdomen and grows sharper with time. This isn't your average stomach ache. And here's where things get really risky. Because once the appendix swells shut, it turns into a ticking time bomb. If left untreated, the pressure keeps building until the appendix can rupture, spilling bacteria and pus into the abdominal cavity. That's when things can get life-threatening very quickly. The tricky part is that you can't predict exactly when or if a rupture will happen, which is why doctors take abdominal pain so seriously. For more than a century, the standard treatment has been an appendectomy, the surgical removal of the appendix. Today, this is usually done through tiny incisions with the help of a small camera, and most patients are back home within a day or two. Even if the appendix does burst, surgery and antibiotics can usually resolve the infection, though recovery takes longer. Living without an appendix doesn't cause long-term problems, so once it's gone, you won't miss it. Interestingly, doctors now know that not every case requires surgery. In some situations, appendicitis can be managed with antibiotics alone. This approach can reduce recovery time, though it's not suitable for everyone. Would you choose surgery or try antibiotics if it meant avoiding the operating room? Drop your thoughts in the comments. I'd love to hear what you do. So, if you ever experience severe or worsening abdominal pain, don't wait it out. Seek medical care right away. Quick treatment makes all the difference. And as for Dr. Rogozov, thanks to his ordeal, expeditions in remote places now carry antibiotics as a precaution, so no one else has to perform their own surgery in the middle of a blizzard. So the next time you hear about appendicitis, you'll know that while it can be dangerous, modern medicine makes it highly treatable. The important part is acting fast. Thanks for watching. If you learned something new today, hit like, subscribe, and turn on notifications so you'll always catch the next video. And feel free to share this one with a friend. You never know who might need it.